Hello, my name is Kath Zeler and I'm a coronary care nurse. I've been a coronary care nurse for many years and I have a passion for heart failure patients and ensuring that they have safe and effective management at home. Whilst they're in hospital, we can provide education, support and tips for longevity of managing their heart failure. But because it's a chronic illness, you'll find that a lot of this has to be carried on to your own environment, where you can pick up your own tips and strategies that make your life sustainable and improve your quality of life when you have a chronic illness. There's 5 topics that I'd like to cover today, and I think you'll find them helpful in your journey as you discover how you make your life worthwhile. The first one that I wanted to talk about is a fluid restriction. You would have noticed that your doctor and your nurses have suggested that you maintain a fluid restriction for the immediate future and indefinitely in some cases. This fluid restriction will be determined by the amount of fluid that your heart can tolerate and also by how much your kidneys can cope with that fluid load. It's usually somewhere in the range of 1.2 to 1.5 litres that we recommend in a 24-hour period. Now that might sound a lot, but when you start to measure it out, you'll come to notice very quickly that there are fluid in a lot of things that we don't take note of, and that you may creep up very quickly. So I've got a few things that I'd like to show you that may help you with that. So let's work on a 1.5 litre fluid restriction because that's the most common one that's prescribed by your heart failure doctor. Now if we take something like a jug of fluid, this jug only goes to a litre, but you could purchase a jug at home that has a 1.5 litre graduation on it. And there's 2 ways that you can measure your fluid restriction. One is by just putting the marking on it at 1.5 litres, or another way to do it, which I've done on the other side, is putting morning tea, lunch, afternoon tea and dinner, so that you know approximately how much fluid you can have by each point in the day. Unfortunately, when you're new to managing a fluid restriction, you sometimes go very hard in the morning and you can get to lunchtime and you're already up to 1 litre, which only allows 500 mils for the rest of the day. By having a system that's visual, it will remind you every day how much you're allowed to have. So for example, you get up in the morning and you have your cup of coffee and you have a glass of milk or a glass of orange juice. You consume that and then you get water and you tip that into the jug and you'll see that it'll come up to around the 200 ml mark. Then when you have your cup of tea, whether it's a cup or a mug or your cafe cappuccino that you get on the way to the shops, you put the same amount into your jug and you can see that there's a visual line going up as you go along through the day. Your heart will cope best with this fluid restriction. If you go a little bit over 1.6, 1.7, or you've got a special event on and you want to have 2 glasses of champagne, maybe your grandchild's getting engaged or something like that, this is not meant to be totally restrictive so that you can't enjoy life. But the next day you need to come back to the 1.5 litre. Otherwise, if you keep going over continually, you'll find that there'll be a change in your heart function, which could manifest as fluid gain, swelling of your ankles, or even some shortness of breath. So although this is a guide, if some days you're not thirsty, maybe you've not had a day where you feel very thirsty and you only get to 1.2 litres, the next day potentially you could have 1.5, 1.6, as long as every day you're aiming for that 1.5. Now there'll be some hidden foods that you don't realise that there's fluids in, and a couple of examples of those are things like ice cream, jelly, and even cooked rice if it's done in the evaporative method because it absorbs water. So these things can sometimes add up as well. There's no need to be too pedantic about it because we don't want it to rule your life, but we do want you to be aware that if jelly is your favourite food and you have 4 jellies a day, that you don't discount them from your fluid restriction. It's not just liquids that are runny. Even things like icy poles and ice also contribute to your fluid restriction. So a couple of tips for medication management, so not the actual medications you take, but how you take them. Sometimes patients struggle, they're on a lot of tablets, they can't get them down, they're quite dry on their throat, and they have to have a big glass of water to get them down. Now a good tip for that is to puree some fruit and put them into the puree, and you can get them down. You're still going to get a little bit of fluid from the pureed fruit, but not as much if you're drinking 1 or 2 glasses. So if you like pureed apples, you can put them into that, have a stock on supply, maybe freeze some, and just pull them out for your medications when you need them. Even if you don't do that every day, but if you know on a day you're going to have a reason to drink more, maybe plan your day out that way so that you can start with a little bit more in reserve. The next thing that can happen, unfortunately, when we restrict our fluids and some of the heart failure medications or other medications you might be on, can cause constipation. And unfortunately, constipation is one of those symptoms or side effects from the medications that don't get a lot of credence when you go to your health professional. It's more about your heart than your bottom. So therefore, it's sometimes difficult to have those conversations, to say that my bowel patterns have changed and I'm suffering from constipation. The definition of constipation is if you don't have a bowel action for 2 days or more, so it's not if you don't go every day. So don't get too concerned if things do change a little bit, but if it's getting severe and you're having difficulty passing a stool, or you notice that there's any discomfort around your rectum or something like that, then you need to act proactively to make sure that that doesn't become a real problem. Now, there's not a lot of things that you can do about the fluids. They're pretty standard at that 1.5 litre fluid restriction, but I would suggest that you consult your doctor about a simple laxative that you could have on standby if this situation arises. A nice natural way to do it is the use of prunes and prune juice, or prunes themselves, which do come in with a little bit of liquid, a good way to keep things natural and regular. However, if you do have prune juice, you need to take something else out of your fluid for that day. So if you normally have a glass of orange juice, which also does have an effect to help with constipation as well, but you replace it with prune juice, you wouldn't have both of those for 2 reasons. One, you may go too far one way and end up with loose bowels, or you may go over your fluid restriction. Trying to keep your diet high in fibre. Fibrous foods like green vegetables and fruit do have a water content, but it's better than soft drinks or carbonated drinks, which will not help your bowels and are just empty calories as well as empty fluids. So you just have to make good choices about what you put into your system to ensure that the system runs well and that you don't suffer from constipation. Thirdly, activity. So like all of us, as we get a little bit older, we do tend to slow down and we make excuses to ourselves as to why that may not be what we should be doing. But for anyone with any chronic illness, but in the heart failure sphere where there are limitations on what you can do, finding an exercise that suits you, that suits your physical capabilities, and that you get enjoyment from is very important. Obviously, walking is an easy one because it doesn't require any equipment or gym memberships, but you may find that your heart failure may limit how far you can walk. So therefore you need to choose a walking solution that perhaps is not got inclines or is not for a long period of time. Maybe you choose to do 10 minutes every 3 times a day or something like that. This additional mobility will not only help you feel well, it will help with your bowel activity because it feeds into emptying your bowel effectively, and it will also make sure that any fluid that's sitting in your peripheries is being circulated around, and some of the peripheral edema that you may suffer from, which is manifest as swelling of your ankles, will be consumed and back into the system. You will be on a number of medications. Some of these may be new to you and you may be unfamiliar with them. All of these medications are carefully chosen for your type of heart failure, and they do interact with each other, and it may be a little bit of trial and error as to how effective they are. We start them sometimes in hospital, but they may have been started in your GP's office and being monitored by your GP, or you may have a follow-up with your cardiologist. It's important to keep a diary or some sort of record of how you are feeling on a day-to-day basis. If you're experiencing any lightheadedness, dizziness, blackouts, or anything that could indicate to your doctors that your blood pressure is on the low side, which this medication can have the effect of doing, then you need to obviously contact your doctor. However, if it's only something where you feel very tired or you're just not feeling quite right, it may just take some time for the medications to synergize with your body and to be effective and not cause those effects for you. Probably the best advice I can give you is not to stop any medication without consulting your doctor first. As I said, these are prescribed for a reason. They're very carefully thought out, and stopping them may cause a rebound effect on the heart, which may land you in hospital, or you may just feel more unwell than you did on the medication. So please consult either your GP or your cardiologist prior to stopping any medication. Now, obviously, you spend more time at home than you're going to spend with us, and we want to maintain that. We don't want you in hospital because you can enjoy your life and manage this situation at home. But you need to know when you need to call us. So there's some forms that are put out either by the hospital you've been in or our hospital here at Mulgrave Private, or you can refer to the National Heart Foundation, which also has guidelines. Now, we tend to use a traffic light system because it's really easy to understand. Green is good, yellow is watch, red is come into hospital or escalate to your care provider. So in the green, things would be that your appetite is good, you're maintaining your fluid restriction, you don't have swelling in your ankles, you're not short of breath, you have no chest pain, and you're generally feeling as well as you can for your condition at that time. The yellow could be a number of things. You may notice that you're weighing yourself and your weight has gone up over 2 consecutive days. So we suggest that you weigh yourself every day before breakfast, before you get dressed. Now, if it's the middle of winter, keep your dressing gown on and weigh your dressing gown and work out the difference. We don't expect you to strip naked and stand there trying to get a weight done. But if possible, try and do it in the same clothes each day and then keep a record of it. So if your weight was 70 kilos on Monday and it's 71 kilos on Tuesday and 72 kilos on Wednesday, then there's a cause for concern and we're now in the yellow zone. So you may have been instructed by your cardiologist to take an extra fluid tablet if this occurs. Please don't take one unless you're instructed by your doctor because they may want to see you before they instigate that. But if you've been given instructions by them and clear guidelines when to take your extra fluid tablet or diuretic, please do so. But continue to monitor your weight, and if your weight goes up the next day and the next day, then please contact your doctor. If you have associated symptoms like shortness of breath, chest pain, then call an ambulance and get yourself into hospital as soon as possible. The other things that we're looking for in that yellow zone might be that your ankles are getting puffy. Now, sometimes in summer, our ankles get puffy anyway because we have our feet down on the ground. But if this is unusual for you, or you've tried to elevate them on a stool or on your recliner chair and they're still getting puffy, then that is abnormal because the fluid should be going back to the heart and draining out of the legs. So if that persists and it's getting worse and you notice that now your ankles are puffy and the back of your legs are puffy, then please notify your cardiologist or your doctor that you see for your heart failure. The other symptom that can be suggestive that your heart failure is worsening is when you go to bed and you lie flat at night and you find that you're struggling to get your breath, or you just find that it's not as comfortable as it was before. And some patients or clients will report to us that they're now sleeping on more than one pillow, whereas they usually slept quite flat, or they've had to put their bed up at an elevation to make themselves feel that they're not drowning or that pressure in their chest is getting worse. This can also reflect that your heart is not pumping the fluid effectively out of your lungs, and this is another sign in the yellow zone that should be escalated to your doctor. The red zone is when you need to call lights and sirens. So this is when you would call 000, call the ambulance and ask them to come and take you into hospital because you either have difficulty breathing that's not getting better, chest pain, you've had lightheaded dizziness, you've had a fall or something like that because your blood pressure's low, or you just feel really unwell and you can't pinpoint exactly what it is, but it might be a combination of those symptoms. By using this graded escalation process, it just allows you to have some independence to manage your own symptoms where you can, but to quickly recognise what are the abnormal symptoms and to seek help when required. Although heart failure is a chronic illness, it's an illness that affects a lot of Australians and it is managed quite safely by your GP, in the community. And with these tips, I hope that you can lead a long and fulfilled life with a good quality of life as well. Thank you very much.